Hello and welcome, my dear friends. This is Dr. Aishvarya Kaushik, and I hope you guys are studying hard. I know it's slightly tough in these times of unpredictability, in which for the past 1.5 to 2 months we've been, continuously trying to figure out when is the exam going to happen. And still, I think for the MDS, for the MDS exam, we still don't have a very clear-cut date. So I know, the pacing of the preparation and so on and so forth gets quite tricky. But I think the most important point here is that don't stress yourself too much. Stay at it. There will be days when your mind is not working at its full capacity, full caliber. Your reflexes are kind of going weak. You're feeling lethargic. So I think we don't have to worry too much about that. That happens with all of us. The most important thing is consistency, right? Try to stick to a given schedule. In order to take breaks, do that in between. But stick to some specific routine, some specific guidelines, even in such unpredictable times, so that you don't, completely disconnect from your preparation, right? That is what is most important. Anyways, coming back to the brass tacks, today we are going to discuss the PYQs, the previous year questions of dental materials. As always, I've tried to bring you a good mix of 20 questions, in which some of, a couple of questions here and there would be slightly easy just to break the monotony. Some of them would be slightly difficult. Some would be absolutely memory based. But the idea is to give you a good mix of questions. And yes, of course, the topics which are asked most often, most frequently from your dental materials perspective is always given priority, right? So we have a mix of, physical and mechanical properties, composites, dental cements, ceramics, dental porcelains, casting investments, gypsum products, impression materials, and so as to give you a get you back in that dental material zone for the time being. I mean, some of you would be preparing for it. Some of you might have have had a gap of say 1.5 2 months since you read dental materials. So just to keep you in touch with things and to keep you motivated, right? Keep your spirits high, guys. Let's start with today's discussion. The first question: microfilled composites are indicated for restoring which type of restorative situations? Again, the moment you see microfilled, your mind should go to what? Particle size. What is the particle size of microfilled? 0.04 micron to 0.4 micron. Wow, this is a good range. These are very small particles. So theoretically, we can have very good solid filler loading of these colloidal silica particles to give us a very strong composite. Unfortunately, for pure homogeneous microfilled composites, that doesn't happen, guys. Why it doesn't happen? The moment you produce these particles, these small, these small 0.04 to 0.4 micron particles, they have this tendency to cluster into grape-like clusters, right? And they drive up. When they cluster, the material becomes so thick because they drive up the viscosity to such high levels that the handling becomes practically impossible. So in order to keep the handling acceptable, so that you can actually manipulate it with your instrument and pack the cavity with these microfilled composites, you have to keep the filler loading really low as 2 to 4% by weight, which is very less. So the filler loading is so low for homogeneous. Please realize, friends, when it is mentioned only microfilled, it implies homogeneous microfilled composites, right? So for these homogeneous microfilled composites, when the filler loading is so low, you can only use it in low stress bearing situations. And that is a class 3 or a class 5, where direct occlusal or incisal edges or occlusal forces do not, are not sustained or not received by the restoration. So class 3 and class 5 are the situations in which a very highly aesthetic, highly polishable homogeneous microfilled composites is indicated, because their filler loading is really low, so they cannot be used in high stress bearing areas of class 1, class 2 and class 4, whereas class 3 and class 5, low stress bearing areas, wonderful polishability, wonderful aesthetics, wonderful finish and polish of microfilled composites, so you can use them there. So just to be very clear with the answer, right? Discussion is one part. I want to be very clear with the answer. Microfilled composites indicated for restoring which type of restorative situations? Class 3 and class 5. Activator and light cure composite. Why have I put this question? I want to repeatedly tell you there's a difference between activator and initiator, guys. What is the activator? Guys, activator is the source of energy. Activator is the source of energy. And initiator is the source of free radical. So when you're talking of a heat cure composite or heat cure acrylic, the activator is heat. When you're talking of light cure composite, the activator is light of a given wavelength. And what is that wavelength? That's another MCQ. That is around, very specifically, 468 nanometer. The range is anywhere between 420 to 500 nanometer. When you talk of initiator for heat cure, it's benzoyl peroxide. When you talk of initiator of light cure composite, it's the camphor quinone dimethyl aminoethyl methacrylate complex. Right, guys? And for self-cure or chemical cure composite, again, the source of free radical is benzoyl peroxide, and the activator for self-cure or chemical cure is a tertiary amine. Right, guys? So activator, again, coming back to the most important point, what is the answer, guys? So the activator in the light cure composite is, therefore the source of energy is what? It's not camphor quinone, it's not dimethyl aminoethyl methacrylate. The source of energy is your visible blue light, right? When you're talking of LED lights, obviously in the olden times it was ultraviolet light. When we used to have ultraviolet light for light curing, we also have plasma curing. So in that we have that source of light. We also have laser activated light curing, so that would be laser. So in general, LEDs are the most commonly used. So visible blue light is your answer, guys. Right? The main difference, next question, guys, the main difference between resin modified GIC and compomer is, what is the main difference? They're all based on GIC chemistry. There's one very specific difference between the two. So let us just quickly revise the composition of number one, GIC, then resin modified GIC and compomer. So what is the composition of GIC, guys? Powder, liquid. What is the powder consisting of? Calcium fluoroaluminosilicate glass, right? And then you have the liquid, which has basically a polyacrylic acid with water, right? Now, when I talk of resin modified GIC, of course, I'm going to be having the components of GIC. So in a powder liquid system, you have, of course, you have the same, that's calcium fluoroaluminosilicate glass, right? But because it's resin modified, so it's going to be having an initiator as well. If it's a self-cure resin modified GIC, it would be a tertiary amine, right? If it's a light cure, it would be your camphor quinone dimethyl aminoethyl methacrylate, right, guys? If it's a self-cure, then it would be the initiator would be benzoyl peroxide. Sorry, not tertiary amine, that's the activator, right, guys? Then in liquid, what do we have? The same things, polyacrylic acid. Yes, you have water. Apart from that, what do you have? You have a monomer, like a hydrophilic monomer, like hydroxyethyl methacrylate, right, which would enter addition polymerization reaction, right? That's the liquid component. And you will be having the activator. So when I'm talking of light cure resin modified GIC, then what is the activator? Source of energy, that's your LED blue light. If it's a self-cure or chemical cure, resin modified GIC, then what is the activator? It is a source of energy, that's a tertiary amine, right? Now, here comes one important difference. Then what is a compomer? The main fundamental difference between the compomer and the resin modified GIC, guys, is that, I'll mark this in red because I'm eliminating this. Water is absent in compomer. Now the details of this, the setting reaction and everything, we've discussed this in great detail in our normal lectures, in our rapid revision, and so on and so forth, multiple times. So I'm not going to go into that details. You have your time-stamped notes. Just go to them. See the detail in this. I don't want to bore you because many of you, if you've been following my lectures sincerely, you should be knowing this. So I'm going to just summarize this, right? GIC will have water. Resin modified GIC will have water. Fundamentally, compomer will not have water. Right, guys? Coming back to the answer, the main difference between RMGIC and compomer. RMGIC contains water. Compomer usually does not contain water. So answer is A. Right, guys? Gas entrapment within the mold leads to which type of porosity in the casting? Again, I'm going to simplify this by just quickly revising the basic, classification of porosity. Not going to go into the details of each and every type of porosity, right? Otherwise, it defeats the purpose of a, marathon, quick revision kind of a PYQ session. So, porosity, guys, very simple. Basically, what is happening here? You have, you have a wax pattern, right, of a MOD inlay, right, guys? And you've invested this. You mounted this on a crucible former, and you've invested this, right, in your investment material. Right? During the burnout and subsequently during the influx of the molten metal inside, there are problems that can occur with your casting. And one of the main problems is porosity, right? Porosity in your casting. This can be due to solidification defects, it can be due to entrapped gases or simply trapped gases. Due to trapped gases, what kind of porosities do we have? You have pinhole, you have gas inclusion, then we have subsurface, and we have back pressure porosity. In this, what is back pressure, guys? What happens is that if during your wax burnout, what if this thickness, the thickness of your investment material that extends from the end of the wax pattern to the end of the ring, right? This thickness, if this is too thick, right, then your gases will not be able to be vented out properly. They would be trapped here in the pores of the investment material, and they would create a back pressure which would prevent free flow of the molten metal inside the mold cavity, and it would lead to porosity, and that is known as back pressure porosity. So in the larger scheme of things, if you have this simple question, gas entrapment within the mold leads to which type of porosity in the casting? The answer is simple, back pressure porosity. right guys? Okay, now again, these hardness questions give us a real pain, isn't it? Knoop hardness, wicker hardness, Rockwell and Brinell, right? So I'm going to simplify this. Okay, anyways, first let us look at the question. Knoop hardness measurement is done with the indenter in the shape of, right? First of all, guys, just in case, there's this confusion going on because a diamond pyramidal kind of an indenter is common to both Knoop and wicker, right? However, more specifically, the indenter for Knoop hardness test is a kind of a flattened diamond. You know, it's like this. So in case you get an image-based question, you see this, right? So there's this long axis and there's this short axis. So this is the exact shape of the indenter that is used to test the hardness by the Knoop hardness test. And this shape is basically a diamond shape, diamond pyramidal shape, which is, as you can see, rhomboid in shape or rhombic in shape, right? And the indentation along the long axis, the longer diameter, longer diagonal is measured, right? So first of all, before going into other details, the answer here is simple: rhomboid. That's number one. What is going to confuse you is the wickers. Why am I telling both together? The wickers is also similar. It's also diamond, but it's more symmetrical. It's a 136-degree diamond. So here, it's like this. You know, that's the shape of your indenting tool. It's more symmetrical. Right, guys? So if you get this kind of a flattened diamond pyramid, that's Knoop. When you get a more symmetrical, equal kind of a diamond pyramid, it's wickers, right? What is common between Knoop and wickers test? Both are micro hardness tests because they're applying lesser loads. And what is the value? Loads of less than 9.8 Newton. So loads of less than 9.8 Newton are applied by the micro hardness tests, which are Knoop and wicker. Right, guys? So for this question, I think this should be sufficient in terms of keeping your information in your head, rotating in your head, right? Great. Then we have some questions from your casting type of questions: casting, soldering, and brazing. Which component of flux helps in the removal of the passivating layer? Right, guys? Now let's just quickly discuss the fluxes here. Let us quickly discuss the fluxes here. So fluxes are basically what? When you have to solder two metal components, they should be clean. The surfaces to be joined should be clean, right? They should be devoid of any oxide layer, which is invariably present on alloys and metals, right? Except for obviously pure gold or pure noble elements, it would be invariably present. So fluxes are those materials which are going to basically ensure that oxide layer is not there for the two metal components ready to be soldered or welded, right? Now, in order to ensure that the oxide layer is not there, either you can prevent the formation of oxide, or you can reduce the already formed oxide, or you can dissolve the already formed oxide. Right, guys? Now, for prevention, usually you have borax or borates, which are basically applied on gold alloys, right? For dissolving, we usually have fluoride fluxes, which are applied on base metal alloys like cobalt based, nickel based. They very readily form oxides, right? Gold does not readily form oxide. So you can be in a situation in which you prevent it. But you have a base metal alloy, it will obviously form oxide, you need to dissolve it or reduce it. Now, these are the most common questions that are asked. What is the mnemonic here? The mnemonic is PRD, parade. You prevent, reduce, and dissolve. Right, guys? So with this basic information, let us just go back to the question here. Which component of flux helps in removal or, dissolution of the passivating layer? So removal also, just like dissolving, it's basically based on fluoride, right? So the answer here is fluoride. I'll just write down this, write this down here also, that for, removal. So removal or dissolving is basically the same thing, isn't it? You're basically removing or dissolving the already formed flux. So fluoride is the answer here. Right, guys? Just for added information, if you can remember, please, it would be good. There is an anti-flux also. You don't want the flux to cover the entire surface of the metal. It will change its properties, right? So the anti-flux is what? It's your rouge, right? That is dissolved in or mixed in graphite, right? Rouge mixed in graphite. That's your anti-flux. That's also a very important MCU, guys. Anti-rust agent. Now, this is a very important question from your conservative basic chapter of armamentarium, that, when you have burrs, you don't want them to get rusted or, get oxidized during your autoclaving procedures. You dip them before autoclaving in 2% sodium nitrite. Memory-based question, commonly asked, that's why I put it. 2% sodium nitrite is your answer. Memorize this. Simple. Again, memory-based question. Again, the one which is causing us pains, hardness test. We've discussed Knoop and Wicker. Then we have two other important tests which employ a huge load. They are known as macro hardness tests, and they are Brinell and Rockwell. Right, guys? So we have Brinell and Rockwell test, out of which Brinell is the older test. It is rather the oldest hardness test. Right, guys? Brinell hardness number is directly proportional to, please memorize this, proportional limit and ultimate tensile strength value. Brinell hardness number is a direct pick from Phillips, and the examiner, sometimes exploits these things. He has, a couple of years back, Ames asked this question. So Brinell hardness number is directly proportional to proportional limit and ultimate tensile strength of gold alloys. First, we'll write this down, then we'll mark the answer. Please memorize this, guys. Brinell hardness test, number 1, oldest hardness test. It is used to check the hardness of metals and metallic materials. All right. What else? It is used to, it uses a ball-shaped steel ball as the testing apparatus, right? Along with Rockwell. These two are the macro hardness tests. Right? Then the MCQ that the examiner is asking, they are used to check the proportional limit and the ultimate tensile strength of gold alloys. Right, guys? That is the MCQ that the examiner asks. I mean, this is one of the tough MCQs, isn't it? We remember Brinell and Rockwell to be macro hardness tests. That's also a very commonly asked MCQ. But the examiners are kind of now troubling us more, right? So, yeah, coming back, Brinell hardness number is directly proportional to or telling us about the ultimate tensile strength or simply the tensile strength. Right? Now, this is interesting. Transformation, next question from Porcelain's. Very favorite question of the examiner these days. Transformation toughening of zirconia occurs due to change in phase from. Guys, just memorize this. Tetragonal to monoclinic. That's the answer. Couple of important points that I want to tell you about this. Besides this, tetragonal to monoclinic. Right? Now, okay. When I talk of zirconia, right? This is zirconium dioxide, right? Now, in general, pure zirconia at room temperature, it exists in the form of its tetragonal state, right? And at high temperatures between 1167 degrees Celsius to 2267 degrees Celsius, that's roughly between 1200 to 2300 degrees Celsius, it exists as at a high temperature, it exists as tetragonal, pure zirconia. And at low temperatures, it exists as monoclinic. Right? That is pure zirconia. Now, what happens is that in general, the volume of monoclinic zirconia is around 3%. Volume of monoclinic zirconia is around 3% more than tetragonal form. Right? So I would want that when my zirconia crown is under a stress, right, is under tensile stress and it's ready to fracture, right, because zirconia and in general all porcelains are brittle materials. They do not undergo plastic deformation. So I want the volume at the crack tip to increase so that the newly formed cracks can compress, right? So I want my zirconia to exist at room temperature at tetragonal state, in the tetragonal state, which it does not. Pure zirconia does not exist at room temperature, it exists at monoclinic state. Whereas it's only at very high temperatures between 1200 to 2300 degrees Celsius that it exists in tetragonal state. Now I want my room temperature zirconia, from which my crown or inlay or onlay is made, to exist in the tetragonal state, so that when it is stressed, then it changes into the monoclinic state, which is greater in volume. For that, I incorporate or dope. I dope my pure zirconia with oxides of ytterbium. Right? This is known as yttria. Yttria. This is yttria. Right? Oxide of yttrium. So yttria stabilized zirconia tetragonal polycrystals. This is what is YZTP. Yttria stabilized zirconia tetragonal polycrystals, meaning that the zirconia, which was supposed to exist in the monoclinic state at room temperature, I incorporate yttria in very less amounts by weight and make the zirconia exist at room temperature in the tetragonal state, so that when it is under stress and when cracks are about to occur, then it changes its crystal structure to monoclinic state, so that it occupies more volume and the cracks are compressed and the zirconia does not fracture. So this phenomenon is known as transformation toughening. And it is because of this that zirconia is sometimes also known as a smart material, because under stress it very smartly changes its crystalline structure from tetragonal to monoclinic. Right, guys? So the answer here is transformation toughening of zirconia occurs due to change in phase from tetragonal to monoclinic. How do you remember this? TM, trademark. That's the mnemonic. TM, trademark, tetragonal to monoclinic. Right? That's the mnemonic. Right? Again, a simple question now, from a tough question to a simple question, guys. Content of copper in high copper alloys is, now by definition, it is greater than 6%. That option is not given. So in general, high copper alloys consists of anywhere between 13 to 30% of copper. So the answer is 13 to 30%. Simple enough. To measure tensile strength of brittle material. Now guys, again, memory based question. There's a diagram in Phillips in which they say that if you have a brittle material means a material which is not undergoing plastic deformation, and you want to measure its tensile strength. In general, brittle materials have they have low tensile strength values. If you stretch them by holding them, clamping them on their two ends and try to stretch them, they fracture very fast. So a better and more convenient way of measuring the tensile strength of a brittle material is to put it under compression. How does that happen? So say for example, you have a small rod, right? Small rod, and you put two horizontal plates and try to compress it. So you basically put this small rod under compression, right? Then it would tend to extend in this direction, and obviously it's going to fracture because it's a brittle material. So this is known as a diametral compression test, indirectly measuring the tensile strength of your brittle material. So a test used to measure the tensile strength of a brittle material is a diametral compression test. If I'm compressing, according to the law of conservation of energy, if I'm compressing one material in this axis, it's obviously going to stretch along the mutually perpendicular axis. Right, guys? So the answer is, this is what? You're applying compression stress, right? Which is leading to extension or tension in the mutually perpendicular axis. Right, guys? So the answer is diametral compression test. Very important question. This can be asked as an image-based question also. This is how the image is made in your Phillips. Right? It can be asked as a theory question also. Okay. Now again, which is used to describe the hardness of gypsum. Now guys, ideally, even Phillips mentions that in order to mention, the strength and hardness properties of these materials, you should be using both tensile strength values, compressive strength values. However, due to some kind of logic or some kind of reason, in general, because again, gypsum, just like other dental materials, is also a brittle material. So it's weak in tension and relatively stronger in compression. So usually when you're comparing gypsum products across the range, you're using compressive strength values, right? Now in compressive strength also, when there is excess water that is present in setting gypsum, it's known as wet compressive strength or wet strength or green strength. And when all the water of, excessive water of crystallization is lost from the pores, then that set gypsum is said to have a compressive strength known as dry strength, right? And the value of dry compressive strength is almost double that of green strength. So in general, by convention, ideally all these answers are correct, right? But the best amongst them is dry compressive strength. So the answer is C, dry compressive strength, which is used to describe the hardness of gypsum, dry compressive strength. Next question, guys. Transverse and longitudinal strain ratio is known as, right? Now, guys, this is again based on the law of conservation of mass. So, for example, if I'm stretching a material, say a rod, right? This is a rod along the z-axis, right? Then it's obviously going to, according to the law of conservation of mass, it's going to be compressed along the two mutually perpendicular axes. So it's going to be compressed along the x-axis also and the y-axis also. Right, guys? So the materials, the ratio of compression over the elongation, the ratio of compression over the elongation is known as Poisson's ratio. That's one MCQ, which is this, the question that is asked. Transverse and longitudinal strain ratio is known as, the answer is Poisson's ratio. Next important question. What is the ideal value of Poisson's ratio? The ideal value of Poisson's ratio is 0.5. And what is the real value in real life? 0.25 to 0.3. So please memorize these two values. Ideal value of Poisson's ratio is 0.5 and real world value or practical value which is observed is 0.25 to 0.3. Right, guys? Next question. This is a question, simple question of elimination, which is not a method of hardening the gypsum die. So you all know you can electroplate a gypsum die by metallizing it with silver in a silver cyanide solution, right? You can use cyanoacrylate adhesive or glue. You can add die hardener. But what you can't do on a die is obviously gold plating, guys. I mean, that's too expensive, isn't it? Don't you think? So gold plating is the answer of exclusion, right? Very often asked question, hydrophilic end of dentin bonding agent bonds to. The moment you see the hydrophilic end of a dentin bonding agent means we're talking of mainly the primer component, right? And it has to wet the already hydrophilic or water-filled dentin. Dentin is, water loving because it is comprised of at least 20% water, as opposed to enamel, which comprises of only 4 to 8% water, right? So it has to bond to the collagen of dentin. So the hydrophilic end of dentin bonding agent, what imparts hydrophilicity to the primer? Acidic groups in the methacrylate chain, right? So hydroxyethyl methacrylate. Why do you add hydroxyl group? It is an acidic group. Hydroxyl is a weak acid as compared to sulfonic acid, phosphonic acid, carboxylic acid. But nevertheless, it is an acid. So weak acid is always added to a hydrophobic monomer like methacrylate in order to make it water loving. Why do you want to make it water loving? So that it wets dentin. Otherwise, there will be phase separation, right? And that's why, in all these bonding agents, some amount of water is always there. Water, acetone or ethanol, right? These are 3 common solvents that are there in your bonding agents and primers, right, guys? So the idea is basically to wet the collagen of dentin, get an intimate contact with the dentin, right? With the newly demineralized dentin. Otherwise, your nice resin hybrid zone will not be formed. They'll initially be micro leakage and nano leakage. You don't want that to happen. So you want good intimate contact of your demineralized dentin with your bonding agent and primer. Fluoride flux is used to, we just discussed fluxes. So this is just a quick revision. What does it do? Quick revision. Parade, PRD. Prevent, reduce, dissolve, or remove. The answer is dissolve. Right? The moment you see fluoride, dissolve. The moment you see borax or borate, prevents. Classification of GIC, again, I find this, you guys have been doing this since second year, but you guys still get confused. So I'm not going to go into the type 1 to type 9 classification. I'm going to be keeping this very simple so that at least you don't get confused in these simple questions. Type 1 GIC. See, guys, I'll tell you a simple mnemonic of remembering type 1 GIC. The chapter is dental cements, isn't it? And the most commonly used application of dental cement is not as a restorative. It is used to lute crowns, right? So type 1 is for luting. Simple. And type 2 obviously is for restorative. And what do you think most commonly you have been doing in your third year and final year amalgam exercises? You're putting a base, right? So liners and bases is the type 3 application. Right, guys? Liners and bases is the type 3 application. So type 1 GIC is luting. As simple as that. Right? Accelerator and retarder in gypsum. Guys, very important. Whether you put an accelerator or you put a retarder, what is it basically doing? I have my newly mixed calcium sulfate hemihydrate. I want to make calcium sulfate dihydrate. I mix it. And there is, the growth of crystals that is taking place. Right? As intercrystalline cohesion that is taking place, they're pushing each other, setting expansion is taking place because they're pushing each other and so on and so forth. Now, the strength of the setting gypsum is because of what? Because of the intermeshing. They're brothers, right? The adjacent growing, they're brothers and sisters, adjacent growing crystals of calcium sulfate dihydrate. If an adulterant, if something is coming in between, it's compromising their sense of cohesion, it would decrease the strength. So irrespective or whether you add an accelerator or retarder, both would decrease the strength. And all types of strength, wet strength, dry strength, compressive strength, tensile strength, they would decrease the strength of the said gypsum product. That's why they are always, added in very controlled quantities. Right, guys? So the accelerator and retarder added in gypsum would decrease the strength. Right, guys? Okay, now another very important and very tricky question. Oxide in porcelain is added. See, the first and foremost thing in porcelain powder, when you add oxide like copper oxide, cobalt oxide, manganese oxide. So copper oxide, it is for color, imparting color. Otherwise, porcelain powder is absolutely colorless. So for example, copper oxide imparts green color. Manganese oxide imparts, say for example, lavender. Cobalt oxide imparts orange, and so on and so forth. Right, guys? There's a in your Phillips chapter, all these 5 to 6 oxides and what color they impart, it's given. Right? So one is obviously they would impart color. The examiner is confusing you here. What is the other thing that these oxides are doing? See, these oxides also act as, when you add oxides in porcelain, like boric oxide, like calcium oxide, like sodium, like potassium oxides, they also act as what is known as glass modifiers. What is a glass modifier, guys? Basically, when you talk of porcelain, classical porcelains, which are what? Feldspathic porcelains. They're based on silicate structure, right? Silica has got this kind of a very strong, chemical structure in which silica tetrahedra, they form very strong structure to the extent that if you have to melt porcelain, you have to reach very high temperatures. If you have to reach very high temperatures, guys, then what about the metal which you are using to make a porcelain fused to metal or a metal ceramic crown? That metal would melt. So you want to add some adulterant which would hinder the relationship between adjacent silica tetrahedra and weaken it so that they start to melt. The porcelain starts to melt at a lower temperature so that the metal does not sag, so that the metal's liquidus temperature or the melting temperature of the alloy is not exceeded. You don't want the metal to completely melt, right, when you're firing porcelain on the metal. So you want your porcelain to have a lower melting temperature, sintering temperature, right? So you add these glass modifiers. So this helps in what? If your metal completely melts, your bonding is gone. Basically, you want your metal and porcelain to kind of bond together well. That can only happen if your metal, maintains its structure, maintains its rigidity, right? So these glass modifiers or these oxides, which one would act as obviously imparting color and aesthetics, and in the other form, the oxides of boron and calcium and sodium and potassium would act to slightly decrease the temperature at which you're going to sinter the porcelain, right? So they would help in improving the bonding and imparting color. So one question that comes is very easy. Oxide in porcelain is added and the option is simply one. Gives you color and aesthetics and cosmetics. That's the answer, no doubt. This other part is slightly tougher. So it helps in improving bonding. It does not really helps in increasing the strength. Increasing in strength happens in the oxides that form in metal alloys, like silver palladium alloys. Here we're talking of oxides in porcelain powder. They help in imparting color and they help in improving bonding between the metal and the porcelain, right? Coefficient of thermal expansion of inlay wax, very commonly asked question. I always do this question in my revision. You know why? First of all, the range 217 to 512 parts per million is the answer, ideal, which can also be expressed as 217 to 512 parts per million. Parts per million, which can also be expressed as 217 to 512 multiplied by 10 raised to the power minus 6. Right? So the question can come in this form. The question can come in this form. Anyways, the closest that is to 270 to 512 ppm is 250 to 350 ppm. So that's the answer. So option D is the answer, guys. Right, guys? So I hope we've had a nice discussion today, guys. I wanted to do this quick revision. Some slightly confusing questions I've put. Wanted you to, get these things going in your head, guys, right? So, chalte firte, ghumte firte, you're going to your mess, going to your lunch, and you think, this was a concept I understood, but now I'm forgetting. Don't try to evade it. Quickly go back, open your book, और उसको पक्का कर लो. Stamp it. It should be crystal clear, right? That is the aim. So best wishes, guys. Keep working hard and keep the faith, guys. Keep the faith. Your relationship with your God is what is going to decide your future. Nobody else can tell you what is going to happen and what is not going to happen, right? So keep praying hard, keep studying hard, keep working hard, and everything will work out well. Thank you, guys. Take care. See you.